We are live. Welcome back. It's afternoon, House Healthcare, March 13th. And we have in with us today Hillary Wolfley. And did I say that right?
You did. Yes, thank you.
And Morgan Bedard. And they're going to talk to us about the VPQHC reports that actually revolved around preventing workplace violence. So thank you for coming in, and again, thank you for last minute.
Yes, it's our pleasure. Thank you for having us today. My name is Hillary Wolfley. I'm the Executive Director of the Vermont Program for Quality in Healthcare. I've been with VPQ for about 10 years. My background, I have my Master's of Science in Public Health and my undergraduate degree in International Development Studies. And I'm joined by Morgan, if you want to introduce yourself.
Hi, everyone. My name is Morgan Bedard. I'm a quality improvement specialist with VPQHC. I administer the statewide patient safety program on behalf of the Department of Health, and I have the fortune of being directly connected to each hospital's quality director through a professional network that we maintain. Prior to joining VPQHC last year, I was the director of quality at CVMC. And briefly, I also bring with me today lived experience from working as a social worker in the hospital setting, where I've personally experienced threats to my life and safety in the workplace setting. I've been looked in the eye by a patient's family member who told me that they would return the following day with a gun. I have facilitated family discharge planning meetings that required the presence of physical security guards in the room due to threats that were received by myself and the physician. And I share that with you to emphasize my appreciation for the energy behind moving this work forward. And I really thank you for having us here today.
Thank you. Thanks for joining us.
And I have a few slides to share, if that's okay. We've tried to just summarize kind of key takeaways from the report.
Sure, that would be great. Thank you.
Before jumping in, this is our first time. I think there are some new faces on the committee. I won't spend a lot of time here, but just to introduce VPQ, because I think this is our first time presenting this year. Quick introduction that we're a nonprofit organization established by the Vermont legislature in 1988. We're a non-regulatory peer review committee, and our mission is to reduce harm and save lives by advancing data-driven solutions that improve healthcare quality in Vermont. We have about 14 staff members, or FTEs, 15 staff members with decades of experience in healthcare quality and direct service across the continuum of care in Vermont. We're also the fiscal sponsor for the Vermont Consultation and Psychiatry Access Program, which some of you may be familiar with. We have a board of directors that's very engaged, very strong, that we're fortunate to have. We have representation from across the continuum of care, and board members include many sectors and represent many different perspectives. I don't know if I need to go into this today. I'll do that another day. But we do have build-back funding, but it can't make up more than 75% of our total operating budget. So I've included a snapshot of our organizational funding. We have philanthropy and other funding that supports VPQHC beyond the build-back. And our core message at the legislature this year, although we haven't been up that much, is just our main goal is to ensure that quality isn't lost in the healthcare reform conversation. And as I've included here, a well-balanced healthcare system must prioritize quality alongside access and cost. So we've been around for 37 years leading quality improvement initiatives, and we have 17 current quality improvement initiatives with different provider settings, including primary care, hospitals, designated agencies, and in partnership with independent mental health providers. And that's for another time, and happy to follow up with any resources or questions that you have. So getting to the report, Act 24 tasked VPQHC with assessing workplace violence prevention in Vermont hospitals, and with looking at many focus areas, which I've included here, such as training and de-escalation, staffing levels, patient assessments, and other areas. Our process for creating this report, we started with a brief literature review to look at the evidence base and best practices. From there, we fielded a statewide hospital assessment to understand the current state of comprehensive workplace violence prevention programs across Vermont hospitals in relation to best practice. We took the data from the assessment and held 5 focus groups with healthcare providers, and I've included some of their titles here, healthcare providers from hospitals, to kind of test our findings, make sure we didn't miss anything, and to capture any qualitative feedback. We then conducted further analysis from the focus groups and formed up our report and recommendations. So strengths and key findings. Strengths related to workplace violence prevention across Vermont hospitals, commitment to safety, a willingness to adopt best practices, and post-incident support for staff. Most common challenges identified across Vermont hospitals: inconsistent de-escalation training, gaps in standardized reporting and data collection, and variation in environmental safety standards. These are some quotes from the focus groups. The first, we all at the same level of care deserve and have a right to standardized resources for safety. It would be helpful if there was a statewide de-escalation program funded by the state, and hospitals are forced to choose between training and other priorities due to limited resources. So recommendations based on our findings: implement standardized de-escalation training, establish a comprehensive, high-quality training program across Vermont hospitals with trauma-responsive care as a core component, among others recommended by the Joint Commission. Enhance. Sorry, was there a question?
No, just a cough. Thank you.
Okay. Sorry, I wasn't looking. Enhance workplace violence incident reporting, invest in infrastructure for staff safety, support ongoing quality improvement and technical assistance, consider establishing a minimum set of safety standards, and support development of a learning network. A disclaimer that this report was, the research for this report was conducted in 2023. While there may be many themes that still carry through, findings may not fully reflect the current state. So we would recommend reassessing to capture updated insights and potentially implementing an annual assessment to track trends and measure progress over time. So key takeaways: workplace violence is a serious problem in healthcare in Vermont and nationally. Best practices do exist for implementing comprehensive workplace violence prevention programs. There is variation among Vermont hospitals, and policy, resources, and continuous quality improvement efforts can help standardize and strengthen the workplace violence prevention across all hospitals. And that's all we have for you today. There are more details in the report. We included a copy of the assessment that we fielded if you're interested in seeing that. I think we also included the focus group questions and just much more detail. Morgan or Nora, neither of us actually did the research or made the, wrote the report. So if there are any questions that we can't answer, we're happy to send them along to the individual at VPQ that did do the research and write the report.
Any questions? Leslie?
So you may not be able to answer, and I totally get it, but I'm wondering if you had a chance to look at H259 and whether you think it addressed some of the concerns that came up in the report.
I have not seen that, no.
Okay, thanks.
Oh, Brian.
Well, I'm wondering, what date did the report come out? I just closed it. I had it in front of me. Oh, here, January 15, 2024.
Yes.
Yeah.
Great.
What was that?
Mhm.
So it was a year ago. Okay, because basically a lot of the things in the report, if not all of them, seem to be addressed in the bill. And I was
Okay,
wondering if the bill was written with this report in mind, or if it just is a coincidence that they happen to be the same things. But I don't know if
That
you
would
know
be
that.
validating if it was written, if it was
mean,
written separately.
I guess we could
and
ask Mari.
confusion.
We could ask the sponsor of the bill, but I think the sponsor of the bill.
Yeah,
Yeah.
Mari, did you write the bill with this work? Is part of the process because it aligns in many ways.
I am working on the record of action right now, so I'm sorry, I'm not like 100% in the conversation, but the bill as introduced does have a regular, I think it's annual analysis included in it as part of the requirement.
What was like the criterias, the things that the bill's doing, was it made with this report in mind, or was it made separate from it? Because they align really well. I think that was the question, right?
That I don't know. I'd have to ask the coalition of nurses that brought the issue to me.
I
Okay,
think the report informed.
it looks like it did.
Yeah.
You should, I guess what the reason I'm bringing it up is like, you should take a look at the bill, and if there's anything in it that you want to weigh in on, we're gonna finish it soon, but you have a chance still, but it does seem to align with the report really well. I guess that was my point, like when I read the recommendations, so.
Any other questions? Thank you both again for coming in, and especially last minute. I really appreciate it, and thank you for your testimony. And it did remind me that you are one entity that we have not had in here yet this year. So hopefully we can get you in soon to talk about all the good work that you do.
Happy to come
Um,
back. Thank you so
thank you.
much.
Thank you.
And I think we're gonna take a break here for a little bit because we're waiting for legislative council.